strategies that will work better. So there are certain teaching strategies that will work better with one domain than the another. So for example, if you see the lecture method, most directly towards the cognitive domain. So if you want to increase their knowledge in the cognitive domain, then you will select the lecture method of teaching. But if you want to bring about a change in the affective domain, you want to teach them good communication skills, behaving skills. So at that time, group discussion and role playing is a better method of teaching. Then again, if you want to increase their skills, right, when they're working, how to give injection. So in that case, the demonstration, re-demonstration, making use of checklists, so those type of things would be good. So the common traditional methods of teaching were lecture and group discussion, whereas the newer methods, which you can see, and the innovative methods you can say of teaching are like jigsaw method, teaching, role playing, simulation, problem-based study, case study, concept mapping, peer-assisted learning, computer-assisted learning, games and reflective learning. And the COVID has taught us a lot of things. We have become more digitalized now. So this was the time when it was very difficult to maintain one-to-one contact, whether it was with our patients or with our students. We switched to these type of newer techniques so that we can give better education to our students also and better care for our patients. So when we were teaching the students, we faced with a lot of difficulties, right? You told them now social isolation is there, you cannot come to college, we cannot go to universities. Now what to teach? Then there was so much of newer techniques coming up. We tried teaching them through e-content, through laptops, through Zoom meetings, through Google Meet. So a lot of softwares were developed, alternative teaching strategies were developed in a short period of time, and still people were taught and they got their degrees also. Similarly for relatives also, we have told them to quarantine. They are in the house and some of them are having symptoms. Some of them are mild, moderate and severe category of patients were there, right? Some of them could be treated in the hospital. We were you go to your home and then you take treatment there, right? So at that time, a different type of care was given to them. We were giving them consultation through telephones. E-nursing was used in there also, right? Tele-nursing, telemedicine, reports. We were interacting with them through different WhatsApp groups, through email. So that's how everything was affected during this COVID period, and more innovative techniques were evolving during this period. Now let's talk about one of the technique of teaching known as jigsaw method, right? So jigsaw is a cooperative strategy that involves group learning. It was developed by Elliot Aronson in 1971. The name jigsaw is given for the structure of the activity of the group. The group is given a problem with a packet of information which is sufficient to allow creative and critical thinking about the solution of a problem. With a member is given one part of the topic to work on, and each member then shares what they have learned with other group members. The goal is that all members, they eventually learn all the information within the packet with the help of each other. Depends on each individual in order to accomplish the task. Now, let me explain to you in a diagrammatic form that what is the meaning of jigsaw method. So, for example, if you have a class of 100, so you will divide them into different groups. For example, you have taken a group of right, group A, group B, group C, and group D. To the whole class, you have divided them into 4 groups, and in each group there are the same number of students. For example, if in group A there are 4 students, in group B also 4, group C also 4, and in group D also 4. Now you will give all these 4 students, you will tell them different things to do. For example, you want to teach them something about congenital heart disease. So to student 1, you will tell them, okay, you read about the etiology. To student 2, you will tell them to read about the pathophysiology. To student 3, you will tell that student to read about the medical management, and the student 4, you will tell him to talk about the nursing management. So 4 different areas you have given to 4 different students in group A. Now the same thing will be given to group B also, C also, D also, right? So these are known as your home groups. Whole class you have divided into 4 groups. In each group, there are equal number of students, and you have divided one big topic into small topics, and you have distributed among the students. Now what will happen from all the groups, all the student ones to whom you have given, told them to read about the ecology, they will form a one group. This is known as expert group. So what is the meaning of home group and expert group? You should know, right? So in this expert group 1, you will have all the students, those who are going to discuss in detail about the etiology of congenital heart disease. Then all the number 2 students, we told them to study about pathophysiology. They all will be discussing in this group, in the expert group 2. They will discuss in detail. You will give them some time to discuss on this topic. Similarly, the number 3 students, they from all the groups, they will come together, they will join, and they will form an expert group 3, and they will talk about the medical management. And then similarly, all the students who were having number 4 from the home group, they will come to the expert group, and this will become an expert group 4, and they will all talk about the medical management or nursing management, right? Now, these are the experts group. Group 1 is expert in etiology, group 2 is expert in etiology, group 3 is expert in medical management, and group 4 is expert in nursing management. Now, once they have discussed, and in this, what is the role of the teacher? Teacher is a facilitator here. He will facilitate the formation of the group and facilitating the discussion within the group members. If someone will not understand, then he will explain and he will clarify what to do. He will refer them from where to get the resources. And once they are done with all these things, then they will go back to their home groups, and then they will discuss all the things in their main group, right? So once they have done everything, this number 1, they will go back to group home A. He will talk about his topic. Number 2 will talk about their topic. Number 3 will talk about their topic, and number 4 will talk about. Now the discussion, they will go back, return to their main group, that is home group, and then they will do the discussion here. So that's how all the 4 groups within the big group has been divided into small groups, and now they will be expert in that topic regarding the management of congenital heart disease. So what is the name of this method of teaching? This is known as jigsaw method of teaching. That the students, they will be learning the team importance of working in a team. That will be learned here, and the new leaders will also emerge from here, right? So what is jigsaw method? Jigsaw is a form of cooperative learning in which students function as keepers and givers of knowledge. The advantage of jigsaw is that you will have positivity, solidarity. There is also individual responsibility. Also, the group work is going on. There is heterogeneity because we are making main groups, subgroups, then they are also going back. Then equal opportunities for success. Every student is involved in discussion. We have given assignment to everyone to study and then come and discuss. They are learning the different values also, like cooperation, group work, how to talk, the communication skills, the leadership skills. So their knowledge is also increasing. Things also. So there was a study done by Patricia and G et al. There was a 2-hour interactive workshop. They used the jigsaw teaching method to teach 84 internal medicine residents about managing geriatric women's health. That is the diagnosis and management of menopause, osteoporosis, urinary incontinence, and abnormal uterine bleeding. And it was found that there was a significant increase in their post-test scores after giving this jigsaw method of teaching. Now, another newer method of teaching is like flipped learning. Now, how is this flipped learning different from traditional method? In traditional method, usually what happens, a teacher comes, he will give the lecture, he will explain the thing, and then he will give the homework, and the student will go back to the home and they will do the homework and come back. Whereas in flipped learning, what is happening? We are giving all the content to study to the student in the form of either in the form of paper or as in the form of soft copy. So they will read the whole content and then they will make their notes. And when they will come to the classroom, they will only discuss about the things which they have studied. If any problem is there, if something which they have not understood, they can discuss with the teacher. So that is flipped learning. So the content is given to them. So in the home, the whole teaching material is given to them. And when they are coming to the classroom, they are just doing the discussion. So in flipped, the teacher instructs the lessons at home. You are giving the whole content to the children in the form of video, in the form of podcast, or you give them books, or you that from here you have to do. And when the students, they will come to the class, they will have deeper understanding of the concepts. They have studied everything. They will know the application and connections to the content. And the students will receive the support as they did when they are in the classroom. Whereas in traditional teacher method of teaching, the teacher will only instruct, the student will take the notes, students will follow guided instruction, a teacher will give the assessment, and students will have the homework to be done. So that is how the flipped learning is different from traditional method of learning. So advantages of flipped learning is that there is more one-to-one time between the teacher and the student. So student is just not a passive learner. Okay, so he is coming home with all the notes, informations, and studying the whole content. It creates a platform for them to ask questions and seek extra help with an area which they find challenging. So wherever the doubts are there, the clarifications are to be done, that will be discussed in the classroom. It encourages students to come to the class prepared. After the students have engaged with digital content at the home, they can come to the classroom prepared with the ideas and questions. And it is a very flexible method of teaching learning. Disadvantage is that it requires greater level of self-discipline, because you will give all the e-content to the students and you will tell them to study. Some of them will study and some of them will not study. So if the students are very highly motivated and they are a self-learner, so at that it will be good for those type of students. So we always say, no, the method which you are trying to teach, it depends on the type of the learners also, their style. What is their style of learning, what is their preference, so it depends on that also. There is another, it relies too much on the technology challenges also. Sometimes the internet will not work, so all those challenges are there. Electricity will not be there, good sufficient infrastructure is not there, an isolated room is not there where they can go and silently study. Whereas these type of things can be easily seen in the school or colleges. You can go to the library in one class, you can sit and study. So there are other challenges when you are studying at the home and when you are studying in the college. There was another author, T-Foon et al., who conducted a meta-analysis of to summarize the overall effects of teaching with flipped classroom approach. And it focused specifically on a set of flipped classroom studies in which pre-recorded videos were provided before face-to-face class meeting, right? So all these are evidence-based teaching methods which you can adopt. And these comparative articles, they focused on healthcare professionals, including medical students, resident doctors, nurses, or learners in other healthcare professionals and disciplines. And flipped classroom approach in health profession education yields a significant improvement in student learning compared with traditional teaching methods. So in this study, this was their main conclusion, that flipped classroom is giving good results as compared to traditional teaching methods. Students expressed high level of satisfaction with pre-class video lectures because the videos, they can be accessed at any time and as often as they desire. So in lecture, what will happen? The teacher will come and he will give the lecture and he will go. Whereas in these pre-recorded sessions, you are having access again and again. एक बार नहीं समझ में आया, दूसरी बार सुन लिया, तीसरी बार सुन लिया. So like that, you can refresh it again and again. Students also regarded the use of small group discussion-based activities in the flipped classroom face-to-face sessions, because these sessions, they help increase their motivation to learn and enhance their level of engagement and interest in the subject matter. Another method of teaching learning which we can use is case method of teaching. The materials used in this case method, they are more extensive, they are complete, and assuming that the previous learning is integrated in the scenario. Case-based method learning or case-based scenarios or problem-based learning, there are somewhat kind of similar things, okay? But so as a teacher, whenever you are preparing cases for the students, you have to be very careful. Whatever the main content is there, which you need to put should be there, and then you can ask the questions. And you should always begin with simple cases, and then you should progress to higher level of cases so that their understanding gets better. So case-based method and problem-based learning both use narrative situations. They select data samplings or statements that present unresolved or provocative issues, situations, or questions. So whenever you are framing a case, you have to be very careful. You see which area needs to be resolved, which is the most important that we need to teach the students, and that case you will take. So as a teaching learning tool, this material challenges participants to analyze, critique, and make judgments, speculate, and express opinions. So whatever cases you are taking, right, they must be very challenging. They must be interesting so that students feel motivated to solve that problem or to solve that case, right? So the information given to the students, it can be either a real information from a real case, or it can be a simulated one. It can be something invented. The situations presented, they must be realistic and they must be believable. So you can give them mock cases also, or you can give them real cases also. That, okay, the patient has come with so and so problems. Now, what is the next nursing action which you can do? So the information which you will provide in these cases, they must be rich enough to make the situation credible, but not so complete as to close off the discussion or exploration. So in the end, there must be some questions which you can ask to the students. So all the information you will not give to them, some little information, then you will ask the questions. Then based on their answers, you will again further add something to the case. Okay, now what is this? Now this is this. And now further what you are going to do. So material may be short for brief classroom discussions, or it may be long and elaborate for a semester long projects. The intent is to bring real world problems into the safe and secure world of the classroom. So we are trying to put them in the safe environment. So instead of directly going into the clinical solving the problems, initially in the classroom, we are trying to teach them through graded learning. They are the rehearsals for life. So both of techniques, they place the students in the role of decision maker, right? That this is the symptom, this is the case. Now what will you do? Okay, now you have done. Now the symptoms are these, and now what? All of you, please keep your mic on the mute mode.
All of you, please make your mic put off. It is making disturbing. We are messaging it once again and again.
Okay, coming back to case-based learning. So the faculty role is to guide the students to resources and information and help the questions to ask and formulate the problems in a clear language and explore and make decisions, right? So what is the teacher doing? Teacher is working as a facilitator. There is more active role from the side of the students as compared to the teachers. Students confront these problems in small groups and they pool their knowledge for successful solutions. These strategies, these give students the opportunities to use previous learning depending on the method used. So slowly, the cases will become more difficult and then their critical thinking will also increase. So case-based learning uses a guided inquiry method and provides more structure during the small group sessions. Now, this is an example of a case-based scenario, how it is to be done. For example, this is the scenario which you will give to the students as a facilitator, as a teacher. So Mr. Anil is a 68-year-old man. He's a retired clerk who has been treated for mild hypertension. He's having bronchitis, appendicitis as a young adult, hemorrhoids and a fractured femur and a splenic injury in motorcycle accident, right? This is the history. So he comes to the emergency room with the chief complaints of cough and fever for so many days. On inquiry, he reveals that yesterday he developed pain in the right chest that intensifies with inspiration. He's coughing continuously with productive cough. The sputum is thick and yellow with streaks of blood. Sitting in a chair, he leans to his right side, holding his right chest with his left arm. He appears tired, faded, and underweight. What more information would you like to take from the patient? What more information would you like to take from the patient to come to a provisional diagnosis? So this you can see how this case has been prepared. So in this case, you have given a brief history also and silent symptoms also. And then you are asking that what is the provisional diagnosis. So in first phase, now once the answer has been given to this question, then again you are upgrading your case. So you make Anil comfortable, right? Make him lie on the bed. You ask him about his smoking history, and he says that he has been smoking for last 50 years, almost 2 packs of cigarettes per day, and he has chronic cough for 10 to 15 years, non-productive, occurring in the morning, and these are the vital signs. When you have done the physical examination, these are the findings. Like in the neck, there is a large non-tender lymph node. The lungs are resonant with percussion, right? There is rhonchi, there are bronchi sounds. These are the findings of the X-ray. Examination of the fingers, it is showing that there is clubbing. Now, what do you suspect Mr. Anil to be suffering from? And what investigations would you like the doctor to order at this point of time to decide the course of the treatment? So this is how slowly and slowly you are making your cases more difficult and more interesting for the students to solve. And once they are giving you the answers on in the end, you will discuss the answers and you will give the feedback to students also. Again, the continuation of that case only. So this is I have given you that how you can make the case-based scenarios. So following the complete examination, history and investigations, the doctor diagnoses Mr. Anil as a case of lobar pneumonia. He admits him to the hospital and immediately starts with the treatment. He administers the first antibiotic dose and sends sample for the urea, electrolytes, full blood counts, ABGs, blood cultures, gram staining and culture. So after 10 days of treatment, Mr. Anil's fever is declined and he feels somewhat better. His chest X-ray reveals a right hilar mass and sputum cytology demonstrates typical cells. Now, what advice would you like to give Mr. Anil at the time of discharge? So I hope now you are understanding that how the cases are to be made, what questions you are going to frame, and based on the answers of those questions, you are going to again make your cases more difficult. So through these case-based scenarios, what type of skills can be learned? Their listening skills, communication skills, their patience, knowledge, time management, patient advocacy, critical thinking, decision-making, and their leadership. So all these are the different skills which can be learned through these case-based scenarios. And these case-based scenarios we can do in our theory lectures also. You can use them in your labs also. And you can, and this is also known as virtual simulation. Okay, virtually simulated cases you are giving to them, because during the COVID times we were not able to give the clinical exposure to students. So how did we teach the students? We gave them these artificial cases, right? That okay, now these are the vitals. This is the condition. Now what will you do? His ABG is falling down. Now this is the condition. These are the findings on the X-rays. Now what you'll do, what is the main nursing management, what is the main medical management in those cases. So that is how the virtual simulation is done. Another teaching methodology is, which can be used in the nursing field, is concept mapping. It was first developed by Joseph Novak and Govin at Cornell University in 1972. Concept maps are graphical representation of a given concept. This reflects the student's cognitive framework and offers insight into their understanding. The placement of the concepts is hierarchical and it is linked by arrows with labeled explanatory phrases. Concept map is what? It is a visual or graphic representation which is used to illustrate and facilitate understanding of relationships between one or more concepts, thus directly enhancing the critical thinking. In addition, the concept maps, they can facilitate the communication between the students and the faculty. Now, when you were studying your different disease conditions, when you see in the different books, you must have seen the different flow charts, right? Some scales and arrows and the graphical representation of that whole disease condition. So these are all examples of concept mapping. For example, you want to learn about rheumatic heart disease. So disease condition you will write in the center, and then around that in the form of a picture, in the form of squares or circles, you will write, okay, this is the etiology, this is the pathophysiology, this is the medical management, this is the nursing management, these are the signs and symptoms. So like that, in a graphical form, a visual picture is there in front of you, and that makes it easier for you to correlate things with each other and to understand, right? So whenever you see, if you theoretically, if someone will explain you that, okay, heart has 4 chambers, blood is coming from here, but blood is going from there, you will not understand it, right? But when you see in the form of a diagram in front of you, then you easily understand. And then the retention is for a longer period of time because your different senses are. When we are talking, only you are hearing. But when you are seeing a diagram, your eyes are also involved, okay? So when too many senses are involved, then the learning becomes more permanent. So the benefits of concept mapping include, it improves the student's ability to organize the body of knowledge. You will learn to organize the things and how one concept is related to another. That etiology is related to pathophysiology, treatment is related to their signs and symptoms and the physiology. Like that, you can make the associations. It allows the students to assimilate previously learned knowledge with newly acquired knowledge. It demands critical thinking skills. So you need to keep your brain alive. It provides a visual aid which can promote learning. It allows the students to identify what they know about the topic and also what they must learn. Students can use concept maps for reading assignments, to map the pathophysiology of a disease, to link the medication regimen of a patient with the disease. So in different parts, we can use concept mapping. There are different designs of concept maps like spider map, hierarchical map, chronological map, flow chart, linear progression, or the systems map. So depending on your needs, you can devise your different types of concept mapping to teach different type of topics. So these are the examples. For example, the components of care for an 80-year-old patient with diabetes. So you will take care of their safety precautions, constipation, skin care, diagnostic test, health instructions, eye consultation, dietary management, and home assessment. This is again different examples. This is a hierarchical map, and this is your linear progression map. So different types of maps you can use. Again, this is a systems map. Okay. So this is another evidence-based study related to concept mapping. Narges Sargozi conducted a study to evaluate the effect of concept mapping as an active teaching method on medical students' knowledge about rabies prophylaxis. And concept mapping as a visual training tool for transferring concepts to medical students is more appropriate than the other traditional ones like book reading. But more research is needed to be sure that active methods are better than the traditional ones. So people have done studies on all these different teaching methodologies and they have found them useful. Another innovative method of teaching is gaming technique, right? Nowadays you play games in your mobiles also. Similarly, now the games have been devised for enhancing your knowledge in your nursing field also. So games, these are the e-learning applications. There is game-based learning, there is gamification, and there is mobile learning. So all the content is, we'll read the content, then there'll be some questions, some numericals to solve, then you will answer them, you will get the scores also. And if you give the wrong answers, then they will give you the feedback also that, okay, why this is wrong and what is the correct answer. So these are the interactive computer applications with or without a significant hardware component. And that has a challenging goal and it is fun to play with, and it incorporates some concept of scoring also, and it imparts in the user a skill, knowledge, or attitude which can be applied in the real world. And games are called serious when they have a pedagogical purpose. So you all must have, nowadays, you know, in the MSc, they are making a lot of mobile apps. You are teaching them through apps. You are assessing their knowledge, you know, pre-test and post-test, and whatever the scores are there, which is the answer which is most given by the person. You know, it can all be diagrammatically shown in the diagram once all the data is fed in that app. So a lot of innovative apps are coming to teach the students also. Even the government has a delivery app, and then is there, right? So games are attractive because they do something that traditional teaching methods do not do. Conventional lecture-based teaching emphasizes transmission and memory. Games are different since they confront the students with engagement.
Students, please keep your mic off. Try to keep your mic off, students. Everyone, please cooperate with ma'am.
Students have the opportunity to develop higher learnings such as application and analysis, and games have a feedback mechanism and can be designed with the range of levels of difficulty. And trial and error in games, it has no fatal consequence because you are only working with the mobile games, you're not working in the real life scenario. So you can practice again and again and you can improve your skills. And it serves to build up the professional skills and also teamwork. So that is another method of teaching. So this is an example of different mobile apps. For example, the Safe Delivery app. It's a smartphone application that provides skilled birth attendants with direct and instant access to evidence-based and up-to-date clinical guidelines on basic emergency, obstetric, and neonatal care. So these are the different apps which you can go and found on the Play Store, and you can download them and you can learn from them. The whole, the care of the preterm has been developed by AIIMS also. No, this was the one which I was talking about, no, preterm care, do no harm. So this is an app which is made by WHO-CC AIIMS. So with NNF, with the help of INN, also with the help of AIIMS Delhi, they have prepared an app, and in that, you can learn about thermoregulation, kangaroo mother care, oxygen administration, developmental supportive care, then exchange transfusion, management and stabilization of preterm infant, use of CPAP, and how to prevent systemic infections. So there are different topics. You can just click on these buttons, you will get the contents, you can read it, and in the end, you can evaluate yourself. So there was another study, Lurie, Gorbanov et al. Conducted a systematic review of serious games in medical education, quality of evidence and pedagogical strategy. And they said that even though game developers claim that the games are useful pedagogical tools, evidence on their effectiveness is moderate, right? So we need to do a lot more researches to see whether it is actually effective or not effective. Another good method of teaching is role playing, which is very good in teaching the communication skills to the students. So role playing is particularly effective in the affective domain and in developing the decision-making abilities, problem-solving abilities. This instructional method is primarily used to arouse feelings and elicit emotional responses in the learner. It is unscripted and it is only improvised, right? So you will give a small condition to two children and then you will tell them to enact in this situation that, okay, now, for example, you are a mother and this is a daughter and the daughter is having some problems. Now, how she will communicate and how the mother will counsel, or one person is a nurse, then how you will counsel this lady who has come to you. So like that, you will give them a small situation. It is not wholly scripted. So whatever they feel as a nurse or as a patient, they have to speak whatever comes to their mind, and then the facilitator will later on, they all discuss with each other that, okay, in this communication, this was right and this was wrong. This could be done. That's how the things can be made better. So that is the feedback you have to give to both the parties, that how you can make your communication more meaningful. So learning is not mastering a role with plans to use it, but to develop understanding of other people in the situation. So once you are in the role play, when you are playing the role of a patient, then you understand that how it feels. The role player responds to each other and not to the audience as characters in the scenario. Members of the class are not involved in the drama, they are only observers, and they contribute to the analysis after the dramatization, that is peer review. So once they have done their role play, then the other people will give them feedback. Okay, you were looking rude here, you were sitting like this, your gestures were like this. So this should not have been done. The teacher role here is passive. She is only a facilitator. She's only guiding. Role playing can be very threatening for those who are in front of them, or even for those who warm up exercise to increase the mind. So warm-up exercises aim to increase the bonding among the group members and create a climate of comfort. Right? Uh,
Please keep your mic off. Students, please keep your mic off. Who is this Galaxy A03? Faculty members, please cooperate with us.
Excuse me, can you hear me?
Yes, ma'am, sure.
Ek minute, I'll just share the screen again.
Okay, ma'am. I'm very sorry, ma'am, for the disturbance.
कोई बात नहीं है. I'll just see. Where was I? So we were talking about gamification techniques, right? Role playing. So role play is very important to teach them regarding communication. So role play can be very threatening for those who to speaking in front of the group, or even for those who are warm-up exercises. They aim to increase the bonding among the group members and create a climate of comfort and relaxation, and debriefing has to be done at the end, right? How much time do we have? I think we have 10 more minutes.
Yes, ma'am, we have 10 minutes more.
So I will just quickly go through the other techniques, okay?
Okay, ma'am. Okay, ma'am.
So another one is your problem-based learning, okay? So जैसे हमने बात करी अभी case-based learning की, it is the same. You will give them a problem and then you will tell them to discuss with each other. And again, the students are more in the active mode as compared to the teachers, and then they will give the answer. It's an essential component of problem-based learning is the content is introduced in the context of a complex real world problem. So in the real world scenarios, whatever you see in the clinical areas, those content you will make and you will start, and this will be your starting point of discussion. And you can divide the students into small groups, and then they should know and how to do the discussions. So after asking critical questions and searching for the relevant information, the goal is to solve the problem or at least shed some light on the unclear situation. Posing the problem before learning the associated content tends to motivate the students. So what is to be done in problem-based learning? You will make a content, a stimulating thought or some scenario, you will give it to the students, and then you will tell them, you will ask them fewer questions, and then you will tell them to discuss on that. And then later on, you will give feedback that what was supposed to be done. They know why they are learning the new knowledge. Learning in the context of the need to solve or understanding the problem, it tends to store the knowledge in the memory patterns that facilitate later recalling of that thing. So before entering problem-based learning, the students should be a skilled problem solvers. So in problem-based learning, the learning is student-centered. Learning occurs in small student groups. Teachers are facilitators or guides. Problems are the organizing focus and stimulus for learning. Problems are the vehicles for development of the clinical problem-solving skills, and new information is required through self-directed learning. So in problem-based learning, the problem is assigned. You identify what we need to know, and then you learn and apply to solve the problem. Whereas in traditional learning, they are told that, okay, this is the thing, now you memorize it, and now you use it. Whereas in problem-based learning, then they need to apply it and see it. Right. Now, another innovation is, if you see, in order to learn the clinicals, that is simulation. So all of you must have seen the different labs and different colleges. You know, they all have simulators, high fidelity simulators, low fidelity simulators. So this helps to enhance the skills of the students in a safe environment. These are all dummies. These are not actual patients. So there is no harm done to the patient. So before entering into the clinical area, in order to resolve their anxiety and their shyness and to build up the confidence in the students, this is a very good technique. Different types of simulations are there, written, audio, visual models. In simulation, the activities involve controlled representations of actual clinical events. So you are allowed to experience a real world scenario, but it is an artificially which is created. Learners are required to assess and interpret the situation and make decisions based on the information provided. It's usually conducted in lab settings. Simulation learning allows students to execute variety of skills. You can learn your assessment, psychomotor skills, decision-making skills, and your critical thinking skills will also improve. Simulated cases of problem situations can be used for either teaching or evaluation. Both psychomotor skills and cognitive decisions can be incorporated. Cases are presented, information is given and requested by the students, decisions are made, and feedback is supplied. So feedback, and whenever you are teaching, feedback is always very important. If you have given some scenario or something to do and the person has done it correctly or not correctly, in both the things you have to give them feedback. If he's doing it nicely, you have to say very good. If something is missing, then you tell them, okay, this step was wrong, and that's how it can be improved. So both in simulation, you can use models also and live subjects also, and it can be combined with computers to make it more real. So there are high fidelity simulators, mid fidelity simulators, and low fidelity simulators. Now this is an example. You see, the people are doing the work, and there are two evaluators who are seeing them, and then later on they will give the feedback. And based on the steps which they are doing, they can again do plus minus in their cases. Okay, now the heart rate is this, now the heart rate is going down, now the breathing has become this, now the person has become blue, now what will you do? So they will give the instructions from here, and then they will see how they are responding. So this is clinical virtual simulation. Professors, they can play the role of learning facilitators rather than giving simple lectures, right? So what is virtual simulation? Virtual simulation is something which we were doing when we were giving the case-based scenarios through online medium, right? Simulation actually is usually when we are calling all the students to the simulation lab and we're giving them conditions. There is face-to-face interaction also between the teacher and the student. Whereas in virtual simulation, I am sitting in one state, students are sitting in another state, and we are interacting through an online medium, through internet. That is virtual simulations. We are giving them scenarios, and then they are telling us, okay, now this is the next step, now it is to be done. So clinical virtual simulation is the recreation of a reality depicted on the computer screen, and it involves real people who are operating the simulated systems. So it is a type of simulation that takes place in a central role through exercising of motor control skills, decision skills, communication skills, using virtual patients in a variety of clinical settings. So again, people have done researches on all these different methods of teaching, and they have seen that they are working, and more researches need to be done on these areas. So when we are teaching through virtual simulation, there are again some challenges, because virtual simulation means we are using internet, we are using technology, and technology can go bad anytime, right? So you need to have good computers, good your sound system, your connectivity sometimes, and then you have to make your cases very interesting and motivating so that students, they are responding, right? So you should know that for each methodology, what are the limitations, what are the challenges, and how you can overcome them, and what is the best method to resolve that problem, whether you are in the clinical area or whether you are in the teaching area. And whenever you are teaching them through anything, any clinical skills, when you are teaching them, you should always have checklist with you. Only then you can measure. And if you cannot measure, then you cannot say that whether the person has learned or not learned. So in order to establish that, okay, that the person is competent in giving this type of care, so you have standards with you, you have checklists with you with those, and scoring is available. And then you can, based on those scoring, you can give them a certificate that, okay, this person is skilled in this and this person is not skilled in this, and he needs more training, right? So these are the different other online platforms which can be used for teaching learning, like WhatsApp groups, Zoom meetings, Cisco, YouTube links are there, right? A lot of apps are there. Different online webinars are available. So much of content is available on SlideShare also, right? Different universities, they have their own portals, like in IGNOU, they're having eGyanKosh. So you can log in there, you can get yourself registered there. Some are paid, some are free. And the whole, online content is there on e-medicine also related to healthcare. All the latest evidence you can get there. And whenever you are practicing in the clinical area, it's very important that you follow evidence-based practices. And in order to implement the evidence-based practices, it's very important that you read the journals, You read the latest issues in your, so for example, if you're working in the oncology department, what are the latest developments that have taken place? So you need to read again and again. You need to attend the rounds of the physicians, whatever the treatment they have ordered to the patient, go and find out that what is the action of this drug, how does this work, how are these two drugs different from each other, what is the action of this, what is the action of this. So you need to be very much willing to learn. Only then your practices will improve. And when you will read a lot of things, you will attend a lot of conferences, you will read the journals, you will attend the webinars, you will talk to different people, you'll come to know that for a single problem which you are encountering in the clinical area, there are many other ways also to resolve. And how each method is different from one another, and which is the best method which I can apply so that I can give best quality care to my patient. So practicing evidence-based evidence-based care is very important to give quality care to the patients. And in order to give this type of evidence-based care, you need a very strong leadership. You need very good commitment from the side of administration also. Right? Now, another innovative method of teaching is OSCE and OSPE. This you all must be knowing. Now the Indian Nursing Council has made it mandatory, right? In your, when that all the students, they need to be evaluated through OSCE and OSPE only. So in these, you know, the different stations are there. All the practical exams, they have to be taken through OSCE. Different stations are there. Students are moved from one station to another. At each station, they have to do something. Some are manned stations, some are unmanned stations, and time limit is there. So within the 5 minutes, they are supposed to do some activity. If it is a manned station, one person will be there who will be evaluating that person, evaluating the student. He'll be giving the scoring, and then after 5 minutes, again they'll be rotated, and all the students will be exposed to all the different stations. And that is a very good method of evaluating the students. So it is in line with the new BSc curriculum, and with appropriate attention to design, acceptable reliability and validity can be achieved for OSCE. It inspires the students' critical thinking and students' communication skills. Right. So in OSCE, you can assess the clinical skills, decision-making skills, communication skills, time management skills, and it also helps you to learn about the teamwork. So OSCE can be done in your lab also, it can be done in the hospital scenario also. Right? So this is how the different stations are there, and the students can be made to rotate from one station to another. So this is already I explained you that how it is done. There are manned stations, there are unmanned stations. You need to decide about the time at each station. Then you do the rotation. And then it's good if you have a camera so that you can give them feedback that how you have performed, and this is wrong and this is right. And whatever the necessary stationery is there, the instructions are there, that has to be given. So before starting the OSCE, all these things we need to keep in mind, that what all articles are needed, what all scenarios are there, and how we are going to evaluate them. So these are just an example of a blueprint of an OSCE, right? For example, 6 stations are there. What is the area that we want to assess? What is the type of station? What are the items in that station we need? What competency you are going to assess in that station? What is the criteria for evaluation and articles required for each station? So if you have a blueprint for that, then the OSCE will become very easy. That okay, everything is done and now we are ready to evaluate the students. This is just an example how people are discussing and compiling the scores and giving the feedback. Feedback can be given verbally also, and through video recording also, you can show them that, okay, this step was wrong, this needs to be corrected. So these are manned stations and unmanned stations, checklists. These are the instructions for the students, right? Then you can communicate, you can evaluate the communication also. So you should have scoring. If you cannot score them, then it's difficult. So these are the different examples of different stations at OSCE stations. They can be image-based stations. And for each station, you should have the answer key with you. Then only you can give the scoring, right? Then at one station, you can give different medicines. You can ask them that what is the indication, what are the side effects, what are the nursing responsibilities. They can be one station for drug calculation. Then you have answer key. Then you can, at one station, you can give them equipments. Right? These are the different equipments which you can put, and you can ask them what is the name and what is the action of this equipment. You can have one station for interpreting the reports. You can show them one report that these are the findings, and now what does it tell us? Analysis and interpretation of the reports. You can show them some growth charts, and then you can ask them to comment where this child is low birth weight, what is the status of the child, right? You can show them some video clips also, and then you can tell them to comment that what is the probable diagnosis, now what is the nursing intervention that you are going to do for this child. Then different pictures, you can show them some surgical conditions, and then you can ask them that what is the name of these congenital anomalies. Then you can compile this course. So these are the different innovations which we can practice in our nursing education side also, or in the clinical side also. In innovations, if you see in healthcare, there are nowadays, this is all the, benefit of having COVID. That was the only benefit, is that we got a lot of newer innovations, infrared thermometers, e-consultation, telemedicine, telenursing. Now the newer innovations are coming, like medical drones, robotic surgeries, and we have electronic medical records. In teaching side, we have online lectures, Zoom, like today we are doing. Then a lot of newer softwares were developed, like eOffice, Amazon. Then we have to practice evidence-based findings in our area so that we can give high quality care to our patients. And innovation means we need to improve, not only we need to develop some articles, we can have some innovations in the processes also, right? What is the process of care? In that also, okay, one care cannot be given through this, but through another method. So you can do some quality improvement studies, small projects in your area, and you can find out that which is the best methodology to resolve this problem. So there is continuous rapid evolution of medical technology. Public is becoming more complex, their needs are increasing, and we need to integrate the knowledge, technical skills, and ethical conduct in nursing practice so that we can provide high quality care. And for innovations to work, you need good administrative support, and you need good leadership, and you need to have the will to learn, continuous learning, always inspiring yourself. So whatever within available resources, you try to find out what best things are working and how we can do it. All for today. Thank you so much. If we have some questions, we can discuss on that.
Students, if you have any doubt, you can ask to ma'am, please. Any query? आप लोग का कोई डाउट, कोई क्वेरी है तो यू कैन आस्क टू द मैम.
No, ma'am.
Any query you have, students? Any doubts?
No query, I think, Pooja. They have grasped the topic very well.
Yes, ma'am.
Okay, so you can carry on session, and thank
Okay,
you.
ma'am.
Note can be
Yes,
taken.
ma'am.
Sachin Bhaskar, we came to know that you don't have any query, so please keep your mic mute. If you have query, then only you have to open your mic. Thank you so much, ma'am. And sir, extremely sorry for the interference. And because of connection, there was some problems. और बीच में बच्चे भी माइक्स बार-बार ऑन कर रहे थे. I'm extremely sorry for that. Ma'am, we are really pleased and very glad that you have discussed all over the topic like OSCE, case method, flip method, jigsaw, innovative in healthcare, and all the innovative trends and topics you have discussed with us. And that is also with all the scenario cases and examples. So we are really pleased to have you, ma'am. Thank you so much.
Thank you so much. Yeah.
Okay, ma'am. Now, ma'am, no duty is more urgent than that of returning thanks. So we heartily thank our today's speaker, Dr. Smriti Arora, ma'am, for giving us valuable information on innovative trend in nursing practice. In spite of your very busy schedule, ma'am, we really have learned and understood a lot in regards to the changing and innovative trends in our profession, which are more effective in providing care to the patient. So thank you so much, ma'am. From a busy schedule, आपने time निकाला and you really gave us your precious time, and you have shared your all the information and all the things which you have shared. That is very important for us in our day-to-day life in caring the patient. So thank you, ma'am. In the same way, I also thank our principal ma'am, vice principal ma'am, OSD College of Nursing, Dr. Professor Ramnivas sir, all the faculty members, students, and all other participants for attending this session and making it successful. So thank you, ma'am, and hope the same days बाद में भी ऐसे हमारे बीच में ऐसे टाइम हो और हम आपके वर्ड्स, आपके लेसन सीख पाए. Thank you for today, ma'am. Thank you so much.
Thank you so much. Okay.
Now, before log out, you all have to fill your feedback form. Means I have already sent the feedback registration form, feedback link that you have to fill, and you have to take your certificates. So without filling the form of feedback, you will not get the certificate. So please fill your feedback form. All the participants are requested to fill their feedback link. Mr. Mukul have already shared the feedback form in the chat, so please fill it.
Pooja, instruct all the participants, they can switch on their camera so that the attendance can be taken for all the participants who have attended the session fully.
Okay, ma'am.
Just.
Okay, ma'am. All the participants, please on your camera and keep your mic off so that we can have one pictures. Hello, ma'am. Good afternoon, ma'am. Thank you for coordinating, ma'am. Although you are on leave, but you have coordinated all the program, ma'am. Thank you. Okay, all the participants, please on your camera and keep your mic off. Everyone, please keep your mic off and your video on.
वीडियो ऑन नहीं हो पा रही मैम सबकी.
Okay, no problem.
जिनके वीडियो आ रहे हैं प्लीज अपना वीडियो ऑन कर लीजिए. MSc Nursing for second year Raj, Neha, Salu, please take the screenshot of this event.
I think it can be taken. It has been taken.
Yes, ma'am.
Okay, on behalf of TMU and Tirthankar Mahavir College of Nursing. So I thank you with whole felt my heart from the to the Dr. Smriti Arora ma'am. She has shared a wonderful session on the innovative trends in the nursing practice, and hopefully all the students and all the participants who have attended the session, they will be utilized in their clinical practice. Thank you once again, ma'am. Thank you so much.
Thank you, ma'am. Now all the students, please fill your feedback form. Then only you can get your certificate. The student who have filled your feedback form can leave the meeting. The students who have filled your feedback form can leave the meeting. Please fill the feedback form for the e-certificate. आपका चार्ज नहीं था Fill the feedback link, students, to get e-certificate. And if you have already filled, then please leave the meeting. Hope everyone has got the feedback link. If any problem is there, if you're not getting the feedback link, please message in chat. Please message me. If you're not getting the feedback link.